Hello and welcome to For Your Health, a program of Quincy Access Television. Thank you so much for joining me. For Your Health that looks at various health issues, health topics, helps you to stay healthy and informed. Joining me today from the Quincy Health Department is Christine Kosha. She is the tobacco treatment specialist. So you can bet that today's topic is going to be all about tobacco. Christine, first of all, welcome to Quincy Access Television.
Thank you, Mark.
This isn't your first time at QATV. Matter of fact, you had done some public service announcements prior.
I did, yes, back in November. You and I got together. The third Thursday of November is the Great American Smokeout. So we did a voiceover for that, which turned out to be a very nice event. We had a table in front of City Hall. We had quite a few people stop by and pick up some information. And then the second part of the day, I was at the YMCA. Same thing. We put a table together, and it turned out to be a very nice event. And
before we actually talk about our main topic, that being tobacco and actually the risks of smoking and the benefits of quitting, that's kind of the presentation we will be talking about today, which is a presentation that you have done throughout the city, correct?
Yes, this is a presentation that we run at some of the schools and businesses that are interested. We've done a few things at the Council on Aging, just giving people some basic information about the benefits to quitting. And a lot of people sometimes are under the impression that once they've been smoking for a number of years, that they've done enough of damage where nothing will improve, and that certainly isn't the case at all. So we like to get the information out there to people and let them know that benefits start to happen within the first 20 minutes after you quit smoking, and they continue with every day that you're not smoking.
That's a good point, because my dad was a smoker, and I think had that same thought that, well, I've been doing it since I was 16, so therefore if I quit now, what benefit will I get? Actually, he did improve his health after quitting, and he probably quit, he probably quit in his 50s, maybe 60s. But even then, his health benefited from not smoking from the period he decided not to smoke.
Absolutely. Yeah, the benefits, it doesn't matter your age. It's never too late to quit, as I tell people, and I've been telling people for all the years that I've been doing this work, which has been 25 plus years. It really never is too late to quit, and the benefits will always happen no matter when you do it. The small things start first, and then the bigger things tend to follow. So you get to that point where your lungs are just as clear as someone who's never smoked at all. So lots of things to look forward to when you quit.
Let's talk about the position in the Quincy Health Department, maybe a little background about you and how you came to this position in this department.
Sure. Well, we started this position, this position, yes, I should say, in March of last year. And the health department had sort of, I think they had the funding to have someone as a tobacco treatment specialist, but they just didn't have anybody that they were able to I guess it wasn't the right fit. So I just happened to have a good background for it. I live here in the city. I had been working for the Boston Public Health Commission, specifically with the Boston Housing Authority. They went smoke-free back in September of 2012. So at that time, I was sort of working with the Public Health Commission to sort of get the word out to the tenants of the BHA, just preparing them for their smoke-free rule that was going into place. And so, just a lot of experience with smoking cessation and tobacco treatment. I was in the second class of people to get a certification in tobacco treatment from UMass Medical School, and that was way back when. As I say, I've been doing this 25 years, over 25 years now. And so when this position became available, it really was something that I was very interested in. So I'm just thrilled that we have something here at the local level for Quincy residents. There is the Smokers Quit line, the Try to Stop Quit line. I believe it's called 100 Quit Now. They changed the name. And that's a great resource for anyone across the state. But it really was great that the mayor recognized that there was a need for this here in the city. So we're able to offer individual counseling. We can offer group counseling. So we have things that we can offer to people right here in the city, which is exciting.
And how would someone get in touch with you in the Quincy Health Department?
Well, my direct number is 617-376-1233. So they can call me directly at any time if they have any questions about quitting. I'm happy to work with anyone individually, as I say, or if there's any organizations throughout the city that want to start a group, we can do that as well. One of the nice things that we're offering is nicotine replacement therapy for people. So we have nicotine patches, we have nicotine gum, and nicotine mints as well. So for anyone who's interested, we're able to offer those as long as they medically qualify. And one of the other things I'll say is this is very unique to Quincy because most health departments, I would say, throughout the state usually refer people to the Smokers Quit line. And again, it's an excellent resource. They offer telephone counseling. But it is nice that we have someone in place here in Quincy that people can come and see. Sometimes people are a little bit more comfortable when they can meet with someone face to face.
And we mentioned a phone number, but the City of Quincy has a website. The Quincy Health Department has a tab on that website, and you are listed on that website.
Yes, absolutely. So that's another way that they can reach us. There's information on the website about the smoking cessation program. I try to post flyers with QATV. We do that as often as we can to make sure people are aware of the program. And, the Council on Aging, they include information on the program in their newsletters. So we have a number of different places that we're putting the information out there. But again, being almost a year now, I've really been excited about getting the word out as much as I possibly can.
Prior to actually sitting down and chatting like we are right now, you had mentioned that a flyer was actually posted at a complex in the north end of the city inside the elevator, and that's how you got an interested person.
I did. I had a tenant that got in touch with me. I had received a call from this particular apartment building back at the end of last year, and they were having some issues with some of the tenants that were smoking inside. So they asked me if I could come by. I offered the services to them. I said, we're happy to offer cessation services to your tenants. We're certainly not telling them that they have to quit, but if they want some assistance, we're here to help. So I brought some flyers by, and they decided on their own just to post them in the elevators. And I did have a tenant call me, and he mentioned several times that that's where he saw it. And so it was nice to see that they were using the information that I brought them, and they were passing it on to the tenants.
And I think certainly you want to reach as many folks as you can, but even reaching one person is a success.
Absolutely. It makes a big difference. And what I would tell anyone that comes to see me, and that I've told people over the years, even if you get yourself down to, if you're a pack-a-day smoker and you're able to reduce the amount of smoking that you're doing, that right there is a victory. So if you continue to you're going in the right direction if you continue to reduce the amount of smoking that you're doing. A lot of people don't like the idea of just picking a quit day and stopping. It gets a little bit overwhelming to think that way. Some people prefer to just gradually cut back, and that's certainly another great way to get to zero when you're trying to quit smoking.
I don't want to spend too much time in the introduction part because we do have a lot to cover. I think we covered that well, by the way. It kind of gave us a basis. Let's move into the presentation, and let's talk about some facts about smoking.
Sure. Well, even now, we are seeing that the cigarette smoking in itself is still the number one cause of preventable death in the United States. We are seeing the numbers of cigarette smokers going down, which is very encouraging. But one of the reasons that we're seeing those numbers go down is because a lot of those people are switching from cigarette smoking to vaping. So vaping, as you know, has become another issue that we are trying to address. We can talk a little bit more about that for sure, but it sometimes can be a little bit misleading when you see those numbers. But we still have cigarette as the number one preventable cause of preventable death in the U.S. Cigarettes contain over 4,000 chemicals.
Speaking about numbers, 4,000 toxic chemicals.
Quite a few, yeah. I sometimes will tell people, if you were to just walk around your own house and pick up just any common items that you have in your cabinets, there are small traces of a lot of these chemicals that are included in cigarettes. There's acetate, things you find in nail polish remover, ammonia, different types of metals, formaldehyde. It could go on and on and on. And so really over time, what people are doing is they're taking very small amounts of these poisons and they're bringing them into their systems with every cigarette that they smoke. So, with nicotine being the addictive substance, it's certainly all of these chemicals that are causing people to get sick and causing death.
And over 70 are known to cause cancer.
Yes, absolutely. Yeah, there are quite a few that cause cancer themselves. And that's various cancers too. I mean, we all usually think lung cancer when we think about cigarette smoking, but It includes esophagus, throat cancer, mouth cancer, stomach, colon, pancreas. All of those things are affected from smoking.
Causes lung disease, stroke, diabetes even.
Yes, there are a number of things. Usually, again, what I tell people is head to toe, there's very little that isn't affected from cigarettes when someone is a smoker. Circulation is another thing. Some people find after years of smoking that they find it difficult to walk. They end up having cramping in their legs, things like that.
So we're talking about the circulatory system at that point.
Yes, exactly. So that's another thing that can be related to smoking. My dad suffered from that himself. He needed to, have surgery on it and to have his artery cleared out. But it was all due to smoking. So, as I say, there's very little that isn't affected.
A lot of folks will be aware of ads currently on television about COPD. Matter of fact, I did a program with a colleague of yours on that topic. Again, smoking can cause COPD.
Absolutely. Yes, it certainly contributes to it. Emphysema, bronchitis, things like that. Those are all things that contribute to COPD. Anybody who does suffer from COPD and smokes, they're just making the situation that much worse. Emphysema, which is caused from smoking, it is an irreversible disease. Once you have it, you have it. But the thing is that people need to understand, again, if you're in the early stages of emphysema and you quit smoking, it'll never progress. So there is always, even if you have something that's sort of irreversible like emphysema is, you can still, certainly, your health can be improved by quitting smoking.
This next fact, everyone I'm sure is aware of at this point, nicotine is highly addictive.
Highly addictive, it is. That is the addictive, so which we touched on, I think, a little bit, but nicotine itself is the addictive part of cigarette smoking. So that is the thing that gets people hooked. And I think when people start for the first time, they either get into it and they really get into it and addicted, or they get into it and they find that they don't like it and they sort of, decide that smoking isn't for them. But once you introduce that nicotine into your system, we have what's called nicotinic receptors, all of us in our brains, and they sort of work kind of like little light switches. So every time you have a cigarette and you bring that nicotine into your system, they're sort of turning themselves off and on every time you have a cigarette. Once you have a cigarette, they turn themselves off, and then the next craving, they're turning themselves back on again. So you're constantly dealing with those little receptors, and that's really what they're designed for. So once you introduce nicotine into your system, that's when the addiction happens.
This is interesting to me, and I suppose you will explain it for me and for the folks at home. Smoking and COVID-19.
Yes. A lot of people don't connect the two. Well, we do know that anybody who's been a lifelong smoker or smoking for several years, their immune system becomes depleted from that. So if you add somebody who smokes and they're, dealing with COVID, it can make matters so much worse. Because the COVID-19 virus actually takes advantage of the fact that the immune system is so susceptible. So most people who are smokers and end up with COVID-19, and that we've seen over the last few years, often end up much sicker than somebody who doesn't smoke.
So it harms the lining of the cells. Is that accurate?
Correct. Yes. It'll sort of latch on to these ACE receptors, which we all have in our lungs. Smokers tend to have more of these receptors, so the COVID-19 virus will sort of use that as a doorway. And that is one way that it gets into the lungs, and it's a way for people to become more severely ill from the virus.
I have a 19-year-old, and when he tells me he's going out to a club, I think to myself, I'm glad that smoking is not allowed in Massachusetts.
Yes.
In venues such as clubs, bars, restaurants. So that brings me to the dangers of secondhand smoke.
Secondhand smoke has always been an issue. For anybody who lives with a smoker, secondhand smoke is something to be concerned about. What we have now, too, is third-hand smoke, which is something that they've just recently added over the years. So secondhand smoke would be something that you would see. Someone who lives with a smoker would be more susceptible to things like little children, like ear infections, things like that. It can affect your health sort of negatively if you're living with somebody who smokes indoors. So third-hand smoke would be what gets into the actual like carpeting and upholstery, draperies, things like that. So that is something that tends to stay when somebody is smoking inside their home. So you'll see the third-hand smoke. It's everything that just sort of kind of accumulates over time. Even pets are exposed. Secondhand smoke, they are at risk of developing things like nasal cancers and things like that. Just constant exposure to somebody who's smoking indoors.
And you think of if you are in the market for a used car and a smoker previously had that car, very, very difficult to get that smell out of that car.
It is.
So if you think about that, then you say, gee, what is it doing to my body?
Exactly. It's true. When you see people smoking, and for me now, even when you see people vaping, like you see, for a lot of them, all that, puff of smoke that you see that comes out when people are vaping, that's usually my thought. If you see all of this coming out, you can only imagine what's going in. So that is a good a way to sort of look at it. If you're looking at all of the smoke that's in someone's car or in someone's apartment, if someone smokes indoors, all of those things that you're seeing, the film that develops on the walls and the windows and things, same thing is happening in your lungs.
So the Surgeon General estimates that living with a smoker increases a non-smoker's chances of developing lung cancer by 20 to 30%. That's
Absolutely.
high.
Absolutely. Yeah, as I say, it's children are especially susceptible because they're still developing. So you usually see things like ear infections are very common with young children that live with smokers.
Asthma?
Yes, for sure. So there are a lot of different things that happen. What we usually encourage, the good news is most people are more than willing to go outside now. Most apartment buildings, as you say, across the state are smoke-free. And if there is somebody who lives in their own home, we're seeing that most people are at least willing to limit it to one room if they need to stay indoors. But most people are willing to go outside now, and they have concern for their family members, which is nice to see.
Let's look at the benefits of quitting. We've already kind of touched upon some of those.
Yes.
Your health can either improve, in most cases it does, or simply not get any worse.
There is, as I say, people need to really, I think I like to have people, most people get a little bit, they tend to look back instead of forward when they're quitting smoking because they're sort of dwelling on what they're giving up, and that can add to a little bit of depression and things like that. But I always try to encourage people to look forward and look at all the great things that you'll be gaining when you do quit smoking. Within 20 minutes of just speaking with somebody, if you're sitting down talking to a smoker, as you're talking to them, I usually try to tell them, as we've been sitting here speaking, your body is already starting to improve itself. The little things first, and then the bigger things follow. So within the first 20 minutes, things like blood pressure, pulse rate, temperature of hands and feet drop to normal. When we talked before about circulation, one of the things that happens as a result of that is cold hands, cold feet. Nicotine doesn't allow oxygen to flow throughout the body. So a lot of people who've been smoking for years, they do sort of complain about having cold hands and cold feet. So that starts to improve pretty much immediately. Within 9 hours, carbon monoxide and your oxygen levels, oxygen in the blood starts to return to normal. Your smoker's breath is gone. And then within a couple of days, taste and smell. People who are heavy smokers usually tend to dull in their taste buds. Things don't taste the way they should. And they start to discover once they've quit that food tastes much better and they can smell things much better than they did before. So those things start to improve. And then, going up within 2 to 12 weeks, circulation. Walking becomes easier, again, as we talked about a little bit. People who were just finding they were having a lot of cramping from walking just from one end of the room to the other, they're finding that they're able to walk more than they did before because everything is just starting to clear out. And then it continues on, within the first month to 9 months, coughing, things like sinus congestion and shortness of breath, all of those things do decrease. What I do like to tell people is sometimes there is such a variety of withdrawal symptoms. They're not always fun to go through, but you really need to keep in mind that every one of these things is a great sign that your body is clearing out and improving. So when you go through them, I know they're not fun, but you just need to tell yourself this is really a great sign. So the coughing especially, a lot of people will come back and say, geez, I've developed a cough. Is this normal? And it really is. That just means that everything in your lungs is starting to come up and out. What I suggest to people is drinking as much water as you can. If you don't already do so, that's going to help to get all of that stuff out that much faster.
Which drinking water is good anyway.
Absolutely, for sure. And when we get to that point where people are feeling like they have more energy and they're just really starting to feel the benefits over the weeks and months, that's when we'll talk a little bit more about introducing exercise into your lifestyle if you don't already. Replacing a negative habit with a positive
That's
one.
what I was thinking. My thought, and you just touched upon it, is that in the time and the place that someone is smoking, if they have to fill a gap, what do they fill that gap with?
Well, usually it would be something just that, something like walking. We try to introduce exercise. Sometimes you're dealing with people who really have never been big exercisers in their life, and they were always sort of used to not doing a whole lot as far as activity. So walking, I think, is one of the best things that you can suggest. It's something that you can do on your own. You don't need to be a member of a gym. You don't need any equipment. You can just get out there anytime that works for you, and you can gradually build up. You can start with 1 or 2 days a week, walk for 15, 20 minutes, gradual increase on that. And I think for a lot of people, when they stick with it, they start to discover that, they love it and they continue to do it.
Let's look at the benefits when we're dealing in years. Within 2 years, heart attack risk near normal.
Absolutely, yes. That's another thing. As I talked about before, some people just being under that impression that the damage has been done and there's no way that I'll ever be able to improve my health if I quit smoking at this point in my life. It couldn't be further from the truth. These are the big things here. So 2 years, heart attack risk. Within 5 years, the lung cancer risk drops 50%, which is fantastic. 7 years, things like bladder cancers, that risk becomes near normal. And then all the way up to 10 years, the risk of most cancers, it really dramatically decreases.
We had touched upon this earlier, and you did mention that we would probably revisit, and we are revisiting now, vaping.
Yes, I wanted to make sure we talked a little bit about vaping. So we are seeing more and more vaping going on right now. And as I mentioned before, you're seeing some people that are switching from cigarette smoking to vaping. I think that the idea is still out there that vaping is safer than cigarette smoking. It is true that most vapes don't contain as many chemicals as cigarettes do, but they do contain many chemicals. If you remember back around 2019, we saw these sudden cases of VALE, which is actually, it stands for e-cigarette vaping associated lung injury. We were seeing a number of those cases pop up with young people, and it was all due to heavy vaping, and it was causing some severe problems with their lungs. We saw a number of people hospitalized, and there were about 6 deaths that occurred, and this was back end of 2019, early 2020. So it was something that came up that was a very serious issue, and so the studies are still out there on the real dangers of vaping, but we know as time goes on that there are more things involved with vaping. Some people for a long time were thinking that there was just water, which isn't the case. Some vapes claim that they don't contain nicotine, and most of them do. So we are still continuing to sort of look at studies about vaping and the dangers of it, but we like to get that out to young people.
You mentioned young people, and vaping was pretty popular with young folks.
Yes.
Matter of fact, smoking certainly
it is. You're seeing,
is too.
You see more younger people. Yes, thank you, Mark. You see more people switch to vaping, or just not trying cigarettes at all. They're going straight to vaping. I think it has sort of that look to it as cigarettes did back, way back when, that it was the cool thing to do, and some kids just get curious and they want to try it. And the fact is, our brains continue to develop until about the age of 25. So with young people, when you're doing these kinds of things, it really does affect your health in a negative way. And, until we get more information about vaping and exactly the issues that can develop from it, we know enough right now that it's never a good idea when a younger person gets hooked on something like this.
This brings me back to the discussion I had with Senator Keenan and the flavored cigarettes, the flavors in vaping, and actually what Massachusetts did.
Yes. So Massachusetts banned all flavored tobacco products back in 2020. And so there is nothing that can be sold that's flavored, and that includes menthol.
And we should mention that a lot of these flavors would be attractive to kids.
Absolutely.
In the first place.
I think that's one of the biggest things about the flavored tobacco products and the vaping products. all of the flavors that they were putting out there until the ban was into effect was all sort of geared towards younger people. And of course, you would see things like banana and strawberry and grape. And of course, that's going to attract kids, and they're going to get curious and they're going to want to try it. So, it was a great idea that all of the things were banned. Menthol, there is a concern with menthol, because with menthol being included in that flavored ban, a lot of people weren't happy about that, because you have a number of people out there who smoke menthol cigarettes. That ban is not in effect in New Hampshire or Rhode Island, so you do have people in Massachusetts that are sort of venturing out to get menthol cigarettes. I know that there is a push to make menthol cigarettes a ban nationwide, so that is being worked on. But the thinking has always been, just hitting on menthol a little bit, that people tend to get hooked on the menthol as well as the nicotine. So it causes sort of a double addiction for people, and it can cause more danger. So it was included when they decided to ban flavors.
As we close this episode, first I'll ask if there was anything that we haven't touched upon that you traditionally touch upon when you give presentations.
I wanted to just make sure that we did touch a little bit on vaping, and just wanted to get the word out there that I know that there are people thinking that it's a safe alternative. Some people decide they're going to quit smoking and pick up vaping just to get themselves off of cigarettes. But the fact is, I think anything that you're breathing in and out of your lungs, other than fresh air, is never a good idea. So I like to stress to people that, if you make the decision to quit smoking, it should be smoking anything at all.
And there's a variety of assistance, I suppose, that folks can rely upon to curb their addiction?
Yes, absolutely. Yeah, I mean, we have the program that we're offered, again, for the residents and community members here in Quincy. I'm available, and I'm happy to speak with anybody if they're wanting to quit cigarettes or vaping or whatever the case may be. There's still the state quit line number, 1-800-QUIT-NOW, which is another great resource. They do offer the telephone counseling, as I mentioned. So yeah, there are a number of resources out there. There's the Truth Initiative is another one that's a website that's available that's geared towards younger people. So that's another great one for younger kids to check out if they want more information about quitting.
And in the last minute or two that we have, I was always surprised. My dad had smoked since he was 16. Again, probably late 50s, early 60s. He quit cold turkey, which I didn't think he'd be able to do. He did. And so that should let folks know that's not an impossibility.
No, absolutely. Yeah, I think the nice thing about quitting smoking today is there are a number of options out there. So what I like to tell people is if you try something and it doesn't work well for you, there's always something else that you can look to. Years ago, cold turkey was really the only thing that was available. And then over the years, other types of nicotine replacement therapy became available, like the nicotine patches and the gum and the mints. They've been around for quite a long time. They have a great success rate. And then there are medications you can get through prescription. There's Chantix and Wellbutrin, which are two medications that doctors can prescribe. And then little lesser known things, there's a nicotine nasal spray, there's a nicotine inhaler. Those are by prescription.
Does acupuncture work? Have you ever found that to be an alternative?
I, again, tell people, like, if you are determined and ready to quit and you're very committed, anything that you try will help you quit. Hypnosis was also another one that was very popular for a while. I think if you go into it determined to want to quit, you'll be successful at whatever you try.
Very good. Well, we are at the end of the program. A lot of information for folks, a lot of information for me. You certainly are welcome back to talk about specific parts of your program. Today it was more of an overview, and we certainly appreciate you stopping by.
Thank you, Mark. Thank you for having me.
Oh, you're welcome. And please come back.
I will, for sure.
And thank you at home for watching, and please continue to support local access television, Quincy Access Television, for more programming just like this.